I'm thrilled to introduce Mari Qureshi, president of the Jessie Ball DuPont Fund, who's our moderator for this first session. Thanks so much, Mari.
So thank you all for being here. I just can't tell you how happy it makes me to have you all here. It's been so long since this great hall was filled, and I don't know if it's the beginning of the end or the end of the beginning, but I feel like there's got to be a light at the end of the tunnel, and your faces are the light for me. So welcome, and I'm so pleased to have you here. I am going to introduce a panel of distinguished speakers, starting with Melanie Patz of the Baptist Health, Dr. Diana Green, and Ariadna. Where are you? There you are. I'm going to introduce them up front, and then I'm going to give you a couple opening remarks about how we, the Jessie Ball DuPont Fund, have been operating in the context of the pandemic and all the other crises that have come along with them. Ariadna Godreau is here from Puerto Rico. So on this panel, she's the person who had to travel furthest to be here. Dr. Green, anyone from Jacksonville knows exactly who Dr. Green is, but for those of you who are not from Jacksonville, she's the chancellor of the schools here and has been an amazing rock in the context of the pandemic for the students and the parents of the Duval County Public Schools. And Melanie is the Vice President of Community Investment and Impact at Baptist Health. You may think Baptist Health is where you go to like get your well child check-in and get all sorts of ailments taken care of, but Baptist plays a big role here in the social sector, as you'll hear from her next. So just a thought, just some remarks about how we at the Jessie Ball DuPont Fund experienced the pandemic. Like all of you, March 2020, we all went home, not to be seen from or except virtually for, a good year and a half, 2 years. And we didn't know what to expect. I don't think any of you knew what to expect either. And we kept thinking, there's got to be a massive impact on our grantees, who are mostly in the not-for-profit sector. And our trustees kept saying, well, are you getting more requests for support? Surely, nonprofits are in trouble. Not really, right? I mean, people can come to us for support, but we didn't see that. They're like, well, what's going on? And, we didn't have an easy way of figuring out what was going on. If people don't come to us seeking funding, we don't have established mechanisms to sort of check in. Now, we did do surveys and things like that, but, you get a response rate on surveys and, 30, 40% is a good response rate, which means 60% of the people, you have no idea what's going on. So it really brought home to us that having established mechanisms by which you listen to the people you seek to serve is an important thing. I mean, we were hearing stats, obviously, right, about what was going on in the communities, pandemic, positivity rates, all of the things that, we all obsessively tracked for the last 2 years. But I don't think we really understood what was going on. I don't know how many of you, at the very beginning of the pandemic, when people stopped driving to places, I'd get out there and go to the grocery stores, have to go somewhere, right? And I would notice people are just speeding like crazy. There's no traffic on the roads, and people are way over the speed limit. Like, what was that about? What could anyone, have predicted that as a result of the pandemic, you get these demon drivers coming out of the woodwork? Like, we don't understand so many things, and when a crisis strikes, these unexpected effects come out. And so I'm going to ask our panelists to talk about some of the things that you know, the surprises that came out of this crisis. So in the absence of people coming to us for, we need more money, we said, well, maybe people are like deer in the headlights. Maybe this crisis is sort of forcing people to think, I don't know what to do, so I'm not going to do anything. And so we started offering, as a funder, a lot of organizational support for our grantees. And many of the organizations that we tap to offer this organizational support are actually here in this room. Lightful, who led the charge on digital fundraising for our grantees, Alex is back there. You may talk to him about those programs. We talked to Candid about encouraging nonprofits to become more transparent about the work they do. Zora's here. Asia, I think, is also here in the room, or will be here soon. Data equity. Evident Change is also somewhere in the room. They will be speaking, they're on the agenda, about data equity. They are specialists in data, and were helping us to be very intentional and thoughtful about how you get data, because the structure of data is not always objective or a level playing field. And then, of course, feedback labs. Many of you in the room may have participated in the webinars and the support that they all gave you in seeking feedback. So I hope that this conference is a way for you to go deeper on that subject. We in the not-for-profit sector don't get market signals. People don't walk away from our products and services because frequently the people who benefit from those services aren't paying for them. So they don't make the judgment of, well, you know, I'm paying this much for this service and it's not worth that to me anymore. When that happens as a for-profit company, you know you've lost that client. In the not-for-profit sector, because someone like us is funding a nonprofit and the ultimate person who is consuming the product or service doesn't walk away, and that's the signal that you have to work harder than in the for-profit sector to get. And so this is a deep dive into all of the different mechanisms and how each of the organizations in this room has dealt with the challenge, and I hope you might have a chance to learn from each other as much as from the panels. So I am going to start with Melanie. As a healthcare institution, you were on the front lines of the pandemic. So how have these last 2 years affected the way Baptist delivers healthcare, or anything else that is in your remit? And how have feedback loops played in that work?
Yeah. Thank you, Mari. It's a delight to be with you all today and to see you in person. And I'm Melanie Patz. I'm with Baptist Health. And for those of you who are not from Jacksonville, we are a locally governed organization, healthcare organization. We have 5 hospitals, including the region's Children's Hospital. We are about to open our 6th hospital in Clay County later this year. And we do want to be your healthcare provider. And I've got colleagues in the room from Mayo Clinic. They want to be your healthcare provider too. And what we're trying to do in our efforts with community health and social responsibility is really help you stay out of the hospital. So we're trying to prevent injury and illness as much as we possibly can. And Mari, I was so delighted to hear you say that when the pandemic happened in March of 2020, you weren't hearing from your partners. We weren't hearing from our partners either. I mean, I think everyone was just sort of like, I don't know what to do. What's going to happen here? And you know, we have pretty good partners in the community. We've been here for over 60 years. Our philosophy is to partner with organizations who have expertise in areas where we don't. We do healthcare. We can do healthcare. There's a lot that impacts our health and our well-being outside of what happens in a doctor's office and what happens in a hospital. And so we're doing the best that we can to deliver high quality, excellent healthcare in those spaces. And we're trying to reach out beyond those walls to improve the health and well-being. And so when we didn't hear from anyone, we started reaching out. And so, the first thing we did, which is what every organization that provides funding in the world did, and that is we released any restrictions on our dollars. So we said, look, you've got money, use it how you need to. Tell us what you're doing with it, because we do need to know that, and you make the decision. And then we started reaching out individually. And then we participated in the feedback labs session. And it was fantastic. And so we thought, okay, let's do something more formal where we're trying to get greater input. And so we did a survey. And we had some good responses to a survey. And I'll tell you, we typically hear positive things, right? We have dollars. And so people don't want to say bad things to us, which I totally understand. And we try hard to create authentic relationships. And we ask for people to tell us when we're not doing things well, so that we can do them better. And we try to model that for others. And so we had the survey, and there were a couple of things that were included in the survey that we could do better, but we had a conversation. So we asked people, if you want to talk with us, tell us what's the best way to get in touch with you. And we had one person, Mike Bell from Volunteers in Medicine. If Mike's watching, I give him all the credit for this. He put his name down and his phone number, and so I called him. And he said, I didn't expect you to call. You put your name down, you put your phone number down. And so we had a conversation, and in the course of that conversation, he suggested that we actually have a process, a mechanism by which we have discussions with our community partners. And so now we do that. It's all virtual at this point, so quarterly we're getting together with all of our partners, and we tell them what's happening with us. We ask them what's happening with them. We try to solve challenges together. So, in the pandemic, it was all about supplies. How do we get supplies? Can you guys help with supplies? We didn't have supplies either. We were just like everybody else. We were trying to get supplies. And then when vaccines came out, it was, how do we get people to get vaccinated? Where are the vaccines? And so we, just worked together on that. And what is your policy on vaccines or masks or all of this stuff? And so, people were willing to share, and Baptist shared what we were doing. And so it was a great opportunity for us to just talk with each other and get a better understanding of what collectively we were facing and support each other as we were going through this really unprecedented time for all of our lives.
Thank you, Melanie. That was I'm glad to hear there's another funder here who was like, what's going on? Why aren't people coming to us? Dr. Green, so I have a kid in Duval County Public Schools, and I cannot imagine what you went through thinking, okay, we were closed down for most of the spring in 2020. Are we opening schools? Are we doing virtual? Are we doing horror hybrid? And if we do hybrid, some of the students will stay home, and maybe that takes care of the people who are really panicked about the pandemic. But if we don't offer hybrid and everyone has to come to school, what do the parents and the children do who really, to Brian's point, had to screw up their courage to show up? How do we make them feel safe? So many questions, and so central. Healthcare is central to our lives. It's possibly the difference between life and death, but whether a child gets educated has so many repercussions on their future life that you too were in the business of, well-being or not. So how did you face those challenges and all the decisions you had to make and all the input you were getting from everybody?
Yeah, feedback is not a problem for us. I get feedback on what I wear to work. Trust me, we do not have a shortage of getting feedback from our families. For those of you that are not from Duval, Duval County Public Schools is the 20th largest school district in the nation, the 6th largest school district in the state of Florida. We serve a little over 130,000 students, and we're the second largest employer in Duval with over 13,000 employees, close to 7,800 instructional personnel. So when the pandemic hit, believe it or not, Duval County Public School was on spring break. So we were not no one was where they were supposed to be. And I called the commissioner of education to say, you know, my students aren't even here. What's happening? How are we going to deal with this? And at the time, they just said, well, we don't know. And I just basically, and I can't to this day believe I said that to him, you have until 2 o'clock, because if you don't make a decision, I will make a decision for my school district, because parents are confused. They don't know what's happening. And so at 2 o'clock, I called the commissioner back and said, we're going to do another week of spring break, because we have to figure out what are we doing. If we are going to completely at-home education, we had to turn that on a dime. And that's what we did. We closed down for another week for spring break and moved into creating this virtual classroom for grades pre-K to 12, and we did it in 3 days. Now, fortunately, we were always a forward-thinking district in that we've had Microsoft Teams for years. Our teachers had been trained in Microsoft Teams, and we were a district moving more and more to a one-to-one system, laptops per students. So we had a great foundation to build upon in those 3 days. And we called back all of our district staff. So our students were on spring break for another week, but we brought everyone back into the building and said, we've got to get these things in place. So Monday morning, when the entire state of Florida went to virtual education, we were able to start with over 112,000 students learning virtually. Part of the feedback that we received from our families was that we found out, even though we were moving to a big one-to-one, many of our families did not have technology or internet access. So within that week, we broke down all of our laptop carts, no matter where they were. We brought all the laptops back to the district and made a plan to distribute laptops to our students that didn't have that device at home. But what we found out was that even our families, our average income families who did have a computer, well, the world went home. So now their computer became their work tool, not their child's tool. And so we had to start giving out laptops for people who really would not ask for a laptop. And we provided over 50,000 hotspots for families that did not have internet access. And so you want to know, how did you know how to get that information? And it came from feedback. Our families are accustomed to the 5 Essentials survey. It's out of Chicago. We've been utilizing the 5 Essentials for the last 4 years. And we get over a 50% response from our families. And it's because that's what we keep pushing. We can't get better if you don't tell us. Trust me, they will tell us, really. They have no problem telling us what we're not doing right. But we utilize that feedback to now get this information to them. And so we heard from over 70,000 families in just responding to us that this is what we need, this is what we need. And from that information, we developed a plan to do curbside and breakfast, lunch, and dinner for our families. That's how we delivered curriculum to students. We utilized our transportation department to start delivering materials to families. We partnered with nonprofits that wanted to get information to families that they couldn't get it. So we'd say, well, we could put it on our school bus, and when they come to pick, we'll give it to them. So those types of relationships and utilizing the feedback from families is really what helped us when in 2021 were we going to open. And so we sent out another survey and asked, and believe it or not, got, again, over 70,000 responses of what they were comfortable with. So if we opened up in brick and mortar, what do you feel like we should ensure that's in our schools? And so we talked about masks, desk shields, and all these things that we ended up putting in our schools came from the feedback from our families. And we moved forward with these options when we opened up in brick and mortar. And I will tell you, in 2021, the one thing that surprised me was the tenacity and resilience of our educators. They were twisted and pivoted so many times it was not even funny, because we opened up with brick and mortar. We opened up with some students in our program called Duval Homeroom, which is learning virtually. Other students doing a hybrid. They come to school 2 days a week, and then 3 days a week they were on virtual. And then we had some students that, I'm only going to do virtual the first half of the year and then come back the second half of the year. So last year we offered 5 different types of education to our students. And our teachers, they adapted, and if you know teachers, they do not like change. But last year, they figured out, you know what, it's the only way we're gonna survive. It's the only way that this is not gonna blow up and you all see me in the town square say, kill her at the stake, kill her at the stake, We had to adapt. When we got feedback, we would develop a plan. Hey, how do we address this? Or we would have to decide, is this feedback only from the few? They're just being really loud. So acknowledge them, help them, be respectful to them, but do not change course, because this is what we need to do for an entire school. And no longer was it a school system, it was our entire community. Because after 2020, when we closed down, I assure you, they hated every day that there was not school, because they wanted their children inside brick and mortar.
Thank you so much. That's not just a dramatic story, but just a heartfelt story of how you persisted in the face of so many challenges. Ariadna Godreau is from Ayuda Legal, Puerto Rico. So she not only faced the challenges of the pandemic, but all of the challenges that Puerto Rico had to face in the last 2 years, which included, hurricanes and all sorts of disasters, electricity outages. Life came to a standstill. So how did feedback play a role in how you responded?
Yeah, first of all, I wanted to say that I'm really grateful to be here. As you were saying, my name is Ariadna. I am the founder and director of Ayuda Legal Puerto Rico. We are a nonprofit that has been working for the past 8 years with legal education and legal support for communities in Puerto Rico. We have a legal empowerment perspective, so our work is really comprehensive. We work with advocacy, with litigation, with community brigades, with technology, and also with this idea that when people know their rights, they are in a better position to defend them. So most of our work is grounded on the right to stay and the right to come back to this place, to this island that we call home. And that's why we work with housing justice and land justice, which has been at the center of, the COVID crisis. The evictions, the fact that people can't afford rents, the fact that working mothers are being disparately impacted by the fact that you can't afford childcare and going to work and transportation and your roof. So Ayuda Legal Puerto Rico has been there. And I'm thinking, while I was listening to you all, I usually say, we have been we have been made ready by several disasters. But that's not true, and I don't want to communicate that there's some sort of value in disaster readiness. We were not made to be always in a disaster fight or flight mode. That provokes burnout, that provokes undermining the values and the mission statement of the work that we want to do as people committed with social change, either in nonprofits or in philanthropy. So I want to talk more about disaster preparedness and how has disaster preparedness and the experience of feedback made us more able to adapt at times of crisis. So as you were saying, Puerto Rico has been hit by several disasters. When Ayuda Legal Puerto Rico was being born with this idea to socialize legal tools, how do we place human rights in the center, which means how do we place human dignity in the center of the work that we do? We knew that the unsustainable public debt was coming for us. And I know there's people from Detroit in the room, so you know how austerity looks like. Schools being shut down, teachers being pushed out. People in Puerto Rico earn an average of $20,000 per year, so that makes us a very impoverished place. We knew also that speculation over the land that locals couldn't afford was coming for us. So we were in the streets and through, the legal accompaniment, through surveys, using tech tools, using community brigades, using one-on-one conversations, gathering feedback. What is the people needing? What are their fears? What are their wants? Which is probably more important than their fears or their needs. And then 2017 came in, and Major Hurricane Maria basically destroyed the infrastructure that was already fragile in Puerto Rico. Thousands and thousands of houses were lost. Also, the fact that people were not able to get power or communications in some places for over a year in the island. And we had to go back there on the streets and start working with people so that they could fill out disaster assistance applications, FEMA, for those of us that know, that structure. And while we were gathering, and we accompanied 20,000 people during this process, and I'm talking about a nonprofit that never requests or receives money from the government, that is not Legal Services Corporation funded, so that means we also serve immigrant communities. These were people that were being really underserved, and they began telling us their stories. I remember having people coming to our table to fill the applications, and after a 2 hours talk, they would say, you know what, I don't want to be in that process, I just wanted somebody to hear me. And we started collecting those stories, the stories of fear, stories of despair, stories of people with indignation because nobody came for them, and the whole story about Hurricane Maria. If not, we can talk about it with some coffee. And then it was 2019 and 2020. 2019, Puerto Rico moved out and pushed the governor that we had. Then 2020, and the earth starts shaking. And it was shaking for 6 months. And houses were again destroyed. So the people who barely got a blue tarp, they lost their walls because we were having several earthquakes. And people were suffering again, and nobody came to have an adequate response. And I remember taking this feedback from the people and transforming it into what it really wants, what it really was, that it was not only a sense of, I need supplies, I need a roof, but it was also the sense that people were committed with the fact that if nobody's going to look after us, we were going to do it by ourselves. And we wanted to learn about that process while we were pushing litigation and advocacy work. And then there was the pandemic. And when the pandemic hit, I remember in March 13, sitting my whole staff in the table, and I already had these huge Post-its that we use that are not environmentally friendly, but we all have them in our offices and are really expensive. So funders out there, please fund Post-it notes for directors and people strategizing. And I said, you know what? We are all leaving early today. You're all going home. Make your family safe. Buy everything that you need. Don't buy toilet paper. There's not a shortage of toilet paper, but buy everything that you need because we need to be out there for the people, and we will do it. And we were already strategizing using the testimonies, using the story, using the cases, using the advocacy wins and the advocacy loss that we had across the whole 4 years, 4 years before. And we were able to make a plan that helped not only sustain the organization, helped rephrase the way that we talked about trust with philanthropy and talking about philanthropy in a relationship with Puerto Rico, with people being in Puerto Rico, talking about self-determination, colonialism, the way that how are things moving on the ground, having difficult conversations, but grounded on experience, grounded on the voices of the people that we were accompanying throughout the years. And we were able to, for example, translate our whole office into this mechanism of accompaniment that was able to be there even when physical distancing was in. So we expanded our legal technology tools into hotlines. So we had hotlines all day, every day, the only hotlines where you can call and there's an actual lawyer on the other side, just telling you that you have a right to stay in your home and that nobody can take you out forcibly of your home. We decided that our disaster program that usually work with housing rights could also work with the rights of working mothers that were being displaced from labor, because we simply, as mothers, we didn't have people to take care of our kids. We started accompanying teachers' union, who were also fighting for the right of our kids to be able to receive the food that was usually distributed in schools, and now because schools were shut down, kids had nowhere to eat. So we were able to be there. And by being there, I think that the feedback changed and shifted. And from that experience, we started accompanying people that we usually didn't accompany. The whole team started getting, because we were at home, sign language classes. So now we accompany deaf community as part of the work that we do. We started learning more about the culture of immigrants in the island. So now we can accompany better immigrants in the island in a more dignified way. And we started getting better, not getting used to disasters, but getting better on how to navigate them. And I think that the voices of the people, that the trust of the people was, I would say that it was at the core of that ability to pivot once again, over and over again.
Thank you, Ariadna. What you're saying about all the different needs that people face. Melanie, you're a health-focused funder, but through this process of seeking feedback, did you discover we talk about the social determinants of health, but the social determinants of health is really the rest of people's lives. And so within this very broad category of the social determinants of health, did you discover things that surprised you or that led you to think, oh, we should be paying more attention to this?
So this is a conversation that started before the pandemic, and we started working with some organizations out at the beach. And the focus initially was, let's see if we can eliminate homelessness out at the beach, because it's a defined geographic area. We thought we could get our arms around it, and we talked with a lot of organizations as well as philanthropists and business leaders in the community, and started out with what are the assets, what are the needs, and we quickly realized, totally unexpectedly, that transportation was a problem, because people can't afford to live at the beach who work at the beach, and it's a lot of service jobs, it's a lot of recreation. And because of that lack of transportation, particularly across the county line from Duval to St. John's, it prevented people from having good jobs that are located in that beaches community. So we partnered with JTA, partnered with a community organization there, the Council on Aging, which operates a transportation program, and we've had some success in addressing transportation. So that was not expected. I mean, we did not expect that would be a solution that would come from this work. And the other big challenge I've already mentioned is affordable housing. And the community folks who came together said, no, we're not starting with that. That is way too big. Forget it. And so we didn't. And then after we felt a little bit successful with transportation, we thought, okay, let's see what we can do. Maybe there's something we can do. Again, pre-pandemic. And there's a lot of challenges, excuse me, in the beaches with affordable housing, not the least of which is the cost of property. And so we started having conversations, and we kept coming up against this idea of NIMBYism, so not in my backyard, and people concerned about density, concerned about environmental sustainability, concerned about their personal property values. And so then we had gotten to the point just before the pandemic where we had a brave mayor of a beaches community, Ellen Glasser at Atlantic Beach, who had said, let's bring the community together and let's have a conversation and just talk about this and see what people have to say about it. And we were in the midst of planning that, and then everything shut down. And of course, everyone's attention turned to how do we stay safe? How do we keep ourselves and our loved ones from dying from this disease we don't know about? And it's very deadly. And so since then, we've started in on these conversations again, and the world has changed. So affordable housing is something that's in the news almost daily. And you have elected officials who are now talking about it. Chambers of commerce are talking about it. So the Nassau Chamber of Commerce is talking about workforce housing and affordable housing. And so now we're thinking, okay, what we had thought before, which was vehement opposition to anything related to affordable housing, maybe that's changed. And so how do we get back to the community and talk with people who live in those communities and find out what are their thoughts today about this? And perhaps it's not as taboo a subject. We've just got some policy challenges and some real practical challenges of the value of property that we need to overcome. So that's something that we think, this feedback is something that's continual because the world around us changes on a daily basis. And so you can't just do it once and say, okay, there was this group that just really came out against this affordable housing opportunity 4 years ago, and so no one's going to allow it again in our community.
Thank you, Melanie.
Thanks.
So Dr. Green, you talked already about how the process of feedback led you to become one of the main actors in, crossing the digital divide in our community. I mean, you're in the business of education, but you ended up having to solve digital divide issues for Duval County. Are there other things that came up, issues that perhaps may not have been central to what you thought your remit was, as you opened up more lines of feedback from the community?
Something that surprised me was that the community really needed us to just be more than an education institution. They needed us when you talked about food. That's when we came up with a plan called the Big Yellow that we have almost 1,000 school buses running every day. We brought those 1,000 school buses and bus drivers back to work and delivered breakfast, lunch, and if they were in certain communities, we delivered dinner as well. We offered curbside, so if you could get to the school, you could come to your school, pick up food for your children. And the reason I was so surprised, I can't remember what day it was, but something happened and 2 of the buses they were delayed. You'd have thought the world had turned on its axis because the emails and the calls, I'm relying on this, I'm depending on this. And so it became very apparent to me that, yes, we are an education institution, and yes, they would get this when they're in brick and mortar, but we found that many families were using that breakfast, lunch, and dinner for other members in the household who were not students. And they relied on that to be consistent Monday through Friday. And then the second surprise is that I think everyone thought young people were going to gravitate to this virtual learning. They have not. They do not. For the most part, they do not like it. For the most part, they need that socialization. They need that connection. They need to see someone physically. Today, we still offer virtual for our families, and today we have close to 4,000 students that are participating virtual. And next year, we believe that is going to drop off by 75% because these families are still struggling. They feel they have to do this, but yet they can see their student is not progressing as they were when they were in brick and mortar. So what the surprise we found out is, I didn't really think it was a surprise, but I think for most people, they think because young people are so techie that they would have gravitated to this, and they do not. There is something to be said for a teacher and the proximity of that teacher to the student. So if you're struggling, you're still sitting the same distance between me and that screen. And I can't turn everybody else off to address you, but when we're in brick and mortar, I can come and just put my hand on your shoulder and say, see me after class, or I can work with you. There's just something about that students need, and you can't get it when you are in a virtual setting. And to the point that this year we are providing so much mental health support to our students because they've lost this sense of connection, but they crave it. And unfortunately, they are finding it in negative ways, not positive ways. And our mental health therapists are spending an inordinate amount of time with helping students reconnect in a positive way with individuals. When we talk about feedback, we have a product called Thought Exchange. And we decided that, we need to do something with our high school students because when we were fully brick and mortar this school year, they came to school looking different than in previous years. We have a very strong code of conduct, and dress code is very, very much spelled out in the code of conduct. And they started wearing interesting things, and it's like, you're violating the code of conduct. It just exploded. And they wanted to be able to wear pajamas to school. And it was because so many of them, when you were virtual, you stayed in your pajamas all day. And we knew we were not changing the code of conduct, but we needed for them to feel respected and heard. And so we utilized this product called Thought Exchange and sent it out, and thousands of high school students responded. It was a simple question. What do you feel should change in the dress code? And of course, the first thing, we should be able to wear pajamas, and blah, 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 blah. And so once we got all of this data, I started having these sort of forums. I would bring several high schools, and yes, we would do it virtually. And so I would ask more leading questions. Hey, do you think, even though a lot of jobs have gone to virtual, but those that, work in an industry that you have to come to work, do you think they're going to allow you to wear pajamas? And of course, once you talk them through it, they understood. Thank you for hearing us. We don't like that you're not going to change the code of conduct to let us start wearing pajamas, but they felt like we were treating them as young adults, not just children. Do as I say, not just do what we say. But this is some of the things that have surprised me from this pandemic, of how we have to not only get feedback from our families, but our students need to have that same vehicle to talk to us and give us information, and vice versa, us talking to them.
You bring up such an interesting point. There is obviously the data aspect of you ask something and you get a response, and you discover that pajamas are really important to high school kids. But the act of being heard, the act of the respect that is implicit in asking and listening and reacting to that feedback. I mean, ultimately, you didn't let them wear pajamas, but the fact that you bothered to have the forums where, in fact, you said, so you want to wear pajamas. we're trying to get you ready for the workplace, and the workplaces aren't going to let you wear pajamas. How is that transition going to happen? I mean, that dialogue is one of the sort of softer elements of feedback loops that is so surprising. And Ariadna, you mentioned that when you had people, they just wanted to vent and to kind of let it be known that they were upset that nobody had been listening to them except for Ayuda Legal, right? So after the venting was done, they were like, okay, well, we don't actually need you to do anything, but you were serving that purpose of soliciting and listening and reacting to that feedback. So when you did, when you had put in all sorts of listening mechanisms into place as a result of the natural disasters that struck Puerto Rico, how did those come into play in the pandemic? Did they serve the needs? Did you have to change them? Tell us a little bit how that played out.
So we had to change a lot the way that we simply met with people. I do agree with you that there's like an urge, a longing to meet with others, to touch people, just to be able to touch you in the arm and say good morning, hello, buenos dias. And there's also a longing of what you said, of being comforted by others that's actually listening to you. We were lacking that, of course, because of physical distancing. We started looking for other outlets. One of the biggest suggestions that we had from the people that we accompany, which is nearly 79% are women. Half of them earn less than $15,000. So they wanted a radio program. They wanted a radio program where we could just go on radio, because radio is still the way that most people communicate. And I wanted to validate that with data, because data is a big piece of the puzzle. So we had the asks, we had people asking for it, writing through our email or calling the hotline, or please, I heard the lawyer this morning in this program, can she go to another program again? The only radio station that I hear is this one, and we would try to get a space in the radio, because we really wanted to be there for them, because once again, they were left alone so many times along so many disasters that they were really afraid that things were going to go berserk and they would be isolated once again. So we commissioned this study, survey, broad survey throughout the island, asking people about legal empowerment and asking them about what is your main source of legal information. And the main source of legal information, lawyers were displaced to a third position, which is great, because lawyers usually, we are trained to as if we knew everything, but we don't. So we were displaced to a third position, and the first outlet for people, even more when they were darker. In Puerto Rico, talking about race is not simply talking about white and black, so we had to design with people working with race studies, a scale where people could identify themselves. And this is very interesting. We can also talk about that. And we found out that darker communities signal to radio as their main source of information. And when we went to the radio programs and we started hearing who are the people talking about law, it's basically influencers or people whose intention maybe were not that in line with social transformation. So we used that data together with the stories and the demands, and now Ayuda Legal Puerto Rico has its own radio program, and I remember calling this funder and telling him, you know what, you remember that operational grant that you gave us? Maybe we'll need a little bit more because we're going on the radio. And they were like, what? And we were like, yeah, on the radio, and the program is on, and it's gonna be on climate justice today, and it's gonna be amazing, you should tune in. And the trust developed with philanthropy over the years, was able to move philanthropy to also come back to the scene and help us turn this survey, these testimonies, this storytelling process into something that we could operationalize, and that's where the radio program tuned in. And I also wanted to mention this very quickly, I don't wanna be really technical. When Hurricane Maria hit the island, 61% of the people in Puerto Rico were denied assistance. The main reason was the fact that owners, people who were forever owners of their homes, lacked a deed. They were informal owners. This is something that's happening across Black communities in the whole US, and it's a way of disinvestment. So people were denied assistance. And we, while we were accompanying people, we realized that, and we started pushing FEMA, advocating against FEMA, which is the Disaster Assistance Administration in the US, to accept the fact that nothing in the regulations required title. To make the long story short, Ayuda Legal Puerto Rico won, and we were staring at each other like, wow. Like, and I remember like the day that my son was born, I was in the hospital talking with FEMA under anesthesia, saying like random stuff, and my staff was like, "What are you doing?" And I'm like, "You can't do that, not here." And we won. And you know, like post-birth, you get the endorphins really high, and we like drank the Kool-Aid of we won against FEMA. You know, this like bunch of lawyers in Puerto Rico, this small nonprofit, we won, and we started talking in every single meeting, community assembly, about, you know, the pitfalls of private title and about the rights of informal owners. And you know, it was about telling people there are other models like co-ops, community land trust, and whatnot. And we drank that Kool-Aid, and we kept talking about it, writing about it, researching about it, litigating about it, and winning. And then one day, I came to this place, which is Loíza. It's a Black community struck by a lot of discrimination in the island, and we have a community paralegal program there, the first one in the island, working in the intersection of climate justice, housing justice, and land justice. And I was there, and I started talking and making like a workshop on titles and land justice, and a Black community leader stood up and said, why every time where lawyers go to medium class or high class communities, they talk about mortgages and the right to have a private title, and when you go to low income communities, you start talking about collective ownership. Why don't we get to also pick? And he started talking about the fact that because of my skin color, somebody decided decades ago who has a right to be called and acknowledged as an owner and who doesn't. And he started talking in his own way about reparations, about slavery, about how the remnants of slavery stay there and decide who gets to be an owner and who doesn't. And in that moment, I learned more than anywhere in my career as a human rights lawyer and a strategic planner for social justice initiatives. And I was there, and that man changed the way that I perceived land justice work. And I pivoted because I was made to, because feedback is uncomfortable. And since then, I think that I'm like more aware of the fact that how winning looks also requires feedback in order to be respectful, sensible, and to acknowledge the disparities that are taking us to the place where we are.
Thank you, Ariadna, for that story. I would like to get your help in thanking Melanie, Dr. Green, and Ariadna